Alcohol is a poison which, if goes directly into your bloodstream, can kill you. So liver is an organ which is the first line of defense against alcohol. So whenever you take alcohol, the alcohol is absorbed from the intestines. The blood with the alcohol goes to the liver. The liver tries to detoxify your blood. So it tries to remove the alcohol and convert it into some other products which are not so harmful. But in the process of this metabolism, the liver cells, they bear the brunt. They take the harmfulness of the alcohol and they try to reduce the harmfulness to your body. So in the process, the liver gets damaged, and that is called alcoholic liver disease. So the amount of fat in the liver cells, they increase. Some toxic metabolites accumulate in the liver, which in the long run give harm to the liver. And this is the alcoholic liver disease. So alcoholic liver disease pertains to dysfunction of the liver. In gradually, in some years, in some months, the liver's metabolism starts going down. So you have the initial symptoms are very much like you must have heard, that is fatty liver. The amount of fat in your liver cells increase. So you have uh, lethargy, you can have loss of appetite, you can have some pain in your right upper quadrant, that is the right side of the abdomen, lower chest. Uh, Usually, patients will, in advanced diseases, patients can have jaundice, or so alcoholic liver disease, if left unchecked, leads to a condition called as liver cirrhosis. So in this condition, the patient starts developing symptoms of liver dysfunction, that is jaundice. Patients can have bleeding from uh, bleeding in vomitings. Patients can have blood in stool. Patient can have distension of the abdomen, that is accumulation of fluid in your abdomen. So these are the symptoms of end stage liver disease. A history from the patient is that he takes alcohol. He's having alcoholic liver disease, so he is chronic alcoholic. The amount of alcohol is in large quantities. So that is the usual history which we have. Then there are some symptoms like lethargy, tremors. Patients have tremors of the hands. Patients are not able to sleep properly. There is insomnia. Patients are not able to concentrate on their work properly because of tremors and liver dysfunction. And then gradually the symptoms are of liver dysfunction, that is the patient will have jaundice, patient will have puffy faced, red cheeks. So these are some of the symptoms which tell us that the patient has alcoholic liver disease. The most important thing is that the patient has to stop alcohol. The patient is uh, made aware that he's having a problem, and then he will have to stop alcohol. That is the first thing. If the patient has started developing liver dysfunction, then we start him on some drugs. Otherwise, mainstay treatment is dietary modifications, exercise, reduction of alcohol. And if the patient is not able to stop his alcohol, then he also might need psychiatric help for de-addiction. The most important thing is that you have to remember that if we see patients of liver failure, so alcohol is number one. The number two reason for liver failure is a condition called NASH, that is non-alcoholic steatohepatitis. So people who don't take alcohol, but somebody who is a heavy diabetic, somebody who is obese, he will also have NASH. The features are similar, as so both the causes are different, but the result of the disease is the same, that is it's an end stage liver disease. So somebody who is not even a heavy drinker but has other comorbid conditions like uh, obesity, especially central obesity, which is common in India, diabetics, can tilt your liver towards alcoholic liver disease. the most common complications in liver failure. Patients come in, there are some patients who come in acute liver failure. So there are some patients who come in chronic liver failure. Patients will have gradual distension of abdomen, accumulation of fluid in the abdomen, which is called ascites. Patients can have severe loss of protein. Patients can have swellings in the feet. Patients can have jaundice. Patients can also present with a condition which is called hepatic encephalopathy. That is, the patient will, he'll start sleeping in the day, he'll not sleep properly in the night. He will have varied symptoms related to his nervous system, confused, agitated. So all these symptoms can be of alcoholic liver disease. So somebody who has gone into end stage liver disease, so we usually tell them to restrict their daily intake of water. There is restriction on some salt, daily intake of salt. The patient has to have a very good lifestyle. He should avoid unnecessary medicines. He should avoid, because all medicines, all food, all junk food, everything goes to the liver. So once your liver is not healthy, you will have to balance all aspects of your life just to maintain that liver. And unfortunately, if the liver still is not able to cope up with your the quality of life is deteriorating, patients end up with liver transplantation as a treatment for liver alcoholic liver disease, end stage liver disease.